on with our introducing our guest speakers. And this is this idea is very near and dear to my heart. And the reason is when my son was going through what he went through by way of his addiction, we were very fortunate as a family in that we had insurance. I had the resources from a financial perspective and otherwise. I'm in healthcare, so I was connected into that space. So I kind of knew people who were in the business of helping people battle this disease. And what I quickly realized when I got involved with FAN is that not everyone is as fortunate as I was to have afforded the very best care in the world. And the purpose of this Feinberg Hope Fund and Foundation was for people who have the financial wherewithal to donate to the fund to help people who don't have the resources to get the care they need. And so when our guest speaker, the CEO of the Children's Foundation, Larry Burns, reached out to me to talk about this, I was excited because there are going to be a lot of people who are going to benefit as a result. And so with that, I'm going to turn it over to Steve Feldman, who has been instrumental in helping put this together. He's going to give an overview on what's going on, the name of the fund, when we're going to get rolling. By the time when we're going to get rolling from the perspective of taking applicants, by the time we're done with the meeting, everyone who is attending and in our subsequent email blasts to everyone, and it's like 1,000 strong now, you will be emailed Ryann Feldman, who is a social worker who will be vetting all of the applicants that come through. You're going to have Ryan's email so you can forward her your name. She will send you an application. And the net of this is you're going to leave this meeting tonight knowing who to reach out to try to see if you qualify for this amazing opportunity. So with that, I'm going to turn it over to Steve Feldman to give a very high level overview of the fund, its purpose, and who's it's intended to benefit, and all of those questions. Steve, why don't you go ahead and take over? Yeah. I will tell you that if you're participating and you treat people with an addiction, you really want to be taking notes. If you're a family member and you have a loved one who is battling addiction and they have the desire to get better and they're lacking the financial resources to get the care they need, you want to be taking copious notes. So with that, Steve, why don't you go ahead and give us an overview on.
Mario, I'm gonna give a little bit of background, and the background is my company Feinberg Consulting works with helping people get into recovery and get treatment. And the way that insurance works and the way that treatment works, there is a lot of services that are not reimbursed by insurance. And in many cases, there are a lot of people that don't have the financial resources to pay for services out of pocket. And in many cases, we were bumping into people that were in need of help and were motivated to get help. And really, it was heartbreaking that services weren't able to be accessed. So through an introduction to the Children's Foundation and to Larry Burns, a fund was created for that purpose. We really want to be able to help people that are motivated to get better and to be in recovery and to change their lives. And we want to be able to help them access resources, which the purpose of this fund is to raise money to do just that. So both, Larry's going to give a broad overview of the foundation, and Ryan will talk about some more of the details. But really, the passion behind this is those that are involved in making this happen want to make a difference and want those that are motivated to have access to the help that otherwise isn't afforded because of the financial barriers that exist. So that really is just a short overview of what has motivated this, and what our hope is very much along what you talk about, Mario, is to change and save lives. So thank you, and thank you for allowing us to be part of this.
Yep. And so the vetting that Ryan will be doing will fall along clinical lines, financial, and motivation to get help and to heal. So with that, Larry Burns is going to talk about this, but I wanted to give some kudos to the Children's Foundation. I've talked about this before, but many of you may not be aware, we grant scholarships to applicants in need. They email us and they let us know their story, 75 words or less. We vote on it, and we hand out scholarships to help with sober living. And one of the entities, in fact, to be perfectly honest, one of the few entities that offered to help us in that regard is the Children's Foundation. And I'll never forget it. When the pandemic started, I was having a conversation with our guest speaker, Larry Burns, and he said, what's going on out there, with everything being shut down and, social distancing and masks, and what are you seeing? How are you helping people? And I said, well, clothes, shoes, underwear, socks, you name it, yoga, exercise, scholarships for sober living. Oh, what's that? And I took the time to explain that to Larry. And within a matter of a month, we had a $10,000 grant check sent to us that is benefiting people in our community, people who have children who, people with an addiction, battling an addiction, who have children. We've specifically earmarked these scholarships for those folks. So the Children's Foundation, while it might be foreign to some of you on this Zoom meeting, the Children's Foundation is not foreign to Washtenaw Fan and to me, and I am eternally grateful for the Children's Foundation and Mr. Larry Burns. And with that, Larry, I'm going to turn it over to you to talk a little bit and then to launch right into your PowerPoint. And before you do that, you guys, we've got permission from the Children's Foundation to record this meeting. It's being streamed live on Facebook, and we've got permission to share the PowerPoint that Larry's about to give, so you can spread it far and wide throughout your network of contacts. So Larry, with that, I turn it over to you.
Well, thank you, Mario, and thank you, Steve, and hello to everybody. Just delighted to be here, and more importantly, I'm excited and honored to be part of this new partnership. And so what I thought I would do is give you a little background on the Children's Foundation, as Mario mentioned, and then talk a little bit more about what we're doing in the recovery world. And then more importantly, talk about what we're going to do with the Feinberg Hope Foundation. So if you bear with me, I'm going to go through a few slides and hopefully it'll give you a sense of who we are and what we're trying to do collectively and then specifically for this purpose. So I'll start with the overview. And my colleague Jill Nelson is working the slides. And so from time to time, I may ask Jill to go to the next slide. So the Children's Foundation is focusing on health and well-being of children, adolescents, young adults, and their families. So we all know the importance of a strong family unit, the impact it has on all of us, but specifically our children and young adults. So think of us as a community-based, statewide organization supporting programs to help people of all ages stay on a healthy path to have rewarding lives, fulfilling lives, and to get the help that they need. We have some pillars that really helps us sort of lead our path. So it's pediatric research, and we've concentrated historically on cancer, cardiology, and those types of things. We have a pillar of medical education. So we're educating teachers, doctors, nurses, care providers of all types. So, and then our largest pillar is community benefit. And this is where most of our new partnerships fall into, making our community stronger, healthier, and better through our support. And we focus on 5 areas. It's not inclusive to the 5, but it helps guide us. So injury prevention, mental health is certainly the one that has risen to the top over the last few years. Abuse and neglect, nutrition and wellness, and research. So our behavioral health, our recovery support mostly falls into the mental health focus area. But we sort of try to cover all of these things throughout the year in supporting programs specifically. So over the last many years, we've granted out over $70 million. And we now, I'm proud to say, we now have 120 grantees or partners throughout the state. In a few minutes, you'll see a slide of our partners and their logos. Most of the organizations, if you were to look at them specifically, you'd be familiar with at least in name, if not in purpose. And that list is growing each and every year. So we're very proud about that. So this is a slide of our current partners and all the logos. And so you can see many of those organizations you're familiar with. They might be right in your community. And that list keeps growing. We have 2 major grant cycles a year. We just had a grant cycle this past week with many new partners. And this year we'll distribute about $7 million to our partners. And so now I'm going to talk specifically about what we're doing with some of our affiliates. So when I say affiliate or initiative, what I mean is we're helping organizations either operate. We created the Jamie Daniels Foundation several years ago with the involvement of the Daniels family, which I'll talk a little bit more about in a few minutes. We now run the First Tee of Greater Detroit. Total Healthcare is a healthcare company that created a foundation. We help them grant money. They're granting out about $5 million a year. We're helping them. And we're growing this list of organizations that we run. And so our newest initiative will be the Hope, or the Feinberg Hope Foundation. And so that will be added to this list as we move forward. So the Jamie Daniels Foundation really was our first major step into helping people as it relates to treatment of addiction. Jamie Daniels tragically died of an opioid overdose, and his family obviously was devastated, is devastated. So Ken and Lisa Daniels, Jamie's parents, approached us. We created the Jamie Daniels Foundation in 2018, and we've raised about $1 million since the creation of this. And the Jamie Daniels Foundation is supporting programs, helping students, helping others in addiction. And it really is one of the things that we're most proud of, that we took this from an idea to several years later having major impact on students, saving lives, and we've raised over, as I mentioned, $1 million in that short period of time. So along with the Jamie Daniels Foundation and the Children's Foundation, we are increasing our grants in the recovery world. And so just last week, we approved this new grant for collegiate recovery, education, and wellness in these 3 universities. And so CMU is very close to Mario's heart. I'm a CMU graduate, so it warms my heart that CMU is taking student recovery serious, helping students that are suffering from addiction. And these grants we share with the Jamie Daniels Foundation. So we in essence split the grant. This grant that we just made is impacting these 3 universities and colleges across the state. So that will be taking place beginning in July. So what we've also supported in this recovery arena, as Mario mentioned, we're a big fan and a big supporter of Washtenaw Fan, and that, we'd like to grant programs and then continue to do that, to evaluate the program, see what's working, adjust accordingly. So we don't like to say, here's a grant, good luck to you, and have a successful program. We're with you from here on in. So we're a foundation that's in it for the long run. We started our collegiate recovery programs with MSU a few years ago. They were the first university in Michigan to dedicate a specific dorm for students at MSU that are in recovery. And so the Children's Foundation, the Jamie Daniels Foundation together have been supporting an RA that's helping those students. By the way, the RA is also a recovering student. And that program continues to grow. They're doing some great things. And we, along with the Jamie Daniels Foundation, continue to support them, see them grow. And then we also are working with Samaritas, along with the Jamie Daniels Foundation. So our grant sort of overview in recovery continues to grow each grant cycle. And I just wanted to give you sort of an overview of some of the things that we've started and then some of the things that we continue to fund. So you met Steve, you haven't met Ryan yet, but it really was Steve Feldman's idea to create the Feinberg Hope Foundation, as both Mario and Steve have indicated, to help individuals in need that also have financial need. So our foundation will be reaching out to people, raising money, working with hopefully many of you that have friends that want to help, so that we can grow the Feinberg Hope Foundation. And why do we want it to grow? We want it to grow so we can help more people. The more money that we have, the more people we can help. And I think all of us on this video realize the need has never been greater. So the more we can do, the more people we can help. So the Children's Foundation will not only be the vehicle to hold the money, but we're going to be part of raising more money on a hopefully daily basis. So this is something that's going to be a priority for us, and we're super excited about it. And with that, I'd like to introduce Ryann Feldman, who is going to sort of be our boots on the ground, if you will, in the Detroit area in Michigan, making this so successful. So Ryann, I'll give it off to you.
Thank you, Larry. Okay, hi, I'm Ryann. So quickly, before I received my master's in social work, so a couple of years ago, I worked in the addiction and mental health field, and I worked on more of an administrative side of things. And that was the first time that I really got insight to the financials that go into receiving quality treatment. So this was the initial thing that really lit the flame for me for being passionate about the financial barriers that exist for people to access care. And I thought that this little statistic, if you look on the right of the screen, I thought that this statistic really encompasses and shows very well how important and how much need there really is for us and helping us reduce these financial barriers. So there was a survey that was conducted in Michigan, and it looked at reasons why individuals didn't seek treatment. And 40% of those suffering from mental illness and 27% of those suffering from substance use disorders said that cost was the main factor that prevented them from treatment. So I can personally attest to this, that I have seen way too many people turned away from treatment because of the financial barriers that exist and the finances that it takes to really receive care at all, let alone quality, good care. And there are so many individuals that will show up motivated and have the need and the drive for these services. And again, they aren't able to receive these services solely because of financial barriers that exist. So again, this is really where we are coming from in creating the Hope Foundation. Jill, go ahead to the next slide. Thank you. So there are three kind of main groups of people that we really are focusing on right now. So the first group is individuals who are willing to give financial support. So as Steve said, as Larry said, the more people that donate and the more people that want to give, the more people we can help. So in addition to that, also, we're ultimately going to be looking for volunteers within the community to help bring awareness and outreach and really involve the community in this. Because again, the more people that know, the more people that we really are able to reach and to help. And then the last group of people, of course, is individuals who may benefit from these scholarships or grants. So if you know anybody, if you personally could benefit from this, the Hope Foundation is being created, and this is literally all that we want to do is to help people. And as they talked about before, again, we really are here to raise money so that we can ultimately give that money to help people receive treatment. Like, it's really as simple as that. So if you fall under any of these categories, if you're interested in getting involved, anything, if you have questions, anything, and my email is right there. I'm the main person that you can reach out to. Of course, reach out to Larry, to Steve, any of us would be happy to talk. I know that Mario is going to include a link for donation, as well as he's going to include my email again. I think he might have said in the chat feature. So you know where to find us. Reach out to me if you have any help. Oh, thank you. Brandon just put it in. So that is all that I have to say. We are just here. We want to help the community. We want to get more people treatment. And yeah, so we're super excited. Mario, thank you for having us on.
You
This
bet.
is so
And
exciting.
just to dovetail off of what Ryan said, and so that everyone knows, this is not exclusive to Washtenaw County community. This is for anyone who needs it. Okay. We had and so in the chat feature, Brandon sent everyone Ryan's email address. She's the liaison between folks who need help and the application. Ryan will be vetting these out with a few other people. And also, Brandon put in the donation link. I don't think I've ever asked members of our community to donate or to help. I can't recall doing that. And one of the reasons is I really don't want to be, I don't want Washtenaw Fan to be beholden to anyone in terms of what we're doing. And what I've learned in the nearly 3 years that we've been at this at Washtenaw Fan is that there are some people who get involved in providing funds who are doing it for the wrong reasons. The Children's Foundation isn't one of those entities. They are the opposite. So I have no problem putting that donation link up there. I will tell you that as often as I can afford to do it, I'm going to provide some funds to this because it's needed.